Hello, I'm Sean Murphy, and this is Data That Moves Us, the podcast from the Limb Loss and Preservation Registry. We explore how high-quality data translates into improved outcomes that drive better care for people living with limb loss and limb difference. Today, I'm speaking with Jeff Brandt. Jeff, please introduce yourself and how you chose O&P as a career.
Sure. Yeah, thanks for having me. Jeff Brandt, certified prosthetist orthotist. A couple of reasons for choosing orthotics and prosthetics as a career. I always wanted to do something in healthcare. So when I was in between my junior and senior year of undergrad back in probably 94, 93, 94, somewhere in there, I had a chance to volunteer at a facility just shadowing where they were treating patients. And I was immediately sold on the profession in terms of just the way that you could help people with, regaining their mobility and their independence, the hugely rewarding nature of the profession. So from that, really that first day moving forward, I just started investigating, all the different pathways into the profession and just reading and learning as much as I could about it. And then as I went on to go to school and practice and grow a practice, really just realizing all those attributes about the profession that I was hoping were true and would be, fulfilling and rewarding as a career choice were and then some. So O&P has afforded me a lot of opportunities, that's for sure.
And so your practice was Ability. And so while you were at Ability, tell us about your experience on Extreme Makeover Home Edition.
Yeah, that was a really cool experience, just to kind of see how TV is done on the other side of things, on the production side of. So this was Extreme Home Makeover, and consistent with Ability, we always tried to be involved in our local communities, right, wherever we had an office, and we're serving the disabled or the limb loss difference population. We always tried to be, if there were 5K running races or wellness fairs or those types of things, we tried to always have an anchor in the community to give back that way. And at the time we had this opportunity, I think a young man had cut part of his hand or his hand off completely in a circular saw accident, just a horrific ordeal. And he was in the Maryland area, and a marketing and public relations firm that we were working with had been contacted by the show and with this opportunity for us to be involved. So we decided as a company that we would donate a prosthetic hand and be a part of the production of the show, which culminated with us in the gym of the boys' high school presenting him with a prosthetic hand from Ability. And then he was able to help with the makeover of his house that his family had been chosen for the show. So, just kind of a, a, a full circle of of what we do in action and impacting people's lives, and then to couple it with the experience of being part of a production like that was kind of cool for the whole company to, we had different employees from the company that came different days of the filming to experience that and what kind of that side of it looked like. But again, great to be part of that show and be a part of it that was providing something that was so impactful to the boy and his family.
Very cool. You had an opportunity to give back and to
Yeah,
show the value and what a prosthetic can do to change somebody's life.
yeah, and we had a watch party as a company, when
Nice.
the episode aired, and that was kind of, very joyous for everyone to celebrate that. So,
I know you've always been very progressive and very focused on data. So at Ability, how did you use data that you had at the time to improve patient care as well as business operations? And how would you have used data that you see available today? Because there's so much more data available today, like we have in the Limb Loss and Preservation Registry.
at the time, so Ability started in 2004, and you're right. I mean, I think there was always this natural craving for, how can we treat these patients and charge what we charge to insurance companies and not have data to base our decisions off of. We decided early on at Ability that we would be an evidence-informed company. And so it may not be scientific research that we're basing our decisions on, but at least whatever that current level of science that was available, we would reference it. So early on, we were citing research papers and data that was in, open source sources of data with insurance companies. So we would write like a letter of medical necessity along with the referring physician, and we would cite the latest treatment pathways and recommendations, things like that. So we would also gather any data we could from our electronic medical records internally to the practice. We would also run custom reports and had invested a significant amount of time and energy into data mining in our own system to come up with what we felt were relevant variables and associations of outcomes, so that when patients came to our facility, we could, in the room, reference our own internal data around patients that were like the one we were just meeting. We could always say, like, look, you could have a completely different outcome, but we do want you to know that we've treated 192 people that are pretty similar to you, and kind of here's how they did, right? Obviously without revealing names and adhering to privacy standards. So it was in our DNA early to really just kind of look for these pearls of wisdom or nuggets of knowledge, no matter how we could get them. The registry, or the LLPR, again, for us, and the registry kind of came more into its own as I was transitioning out of owning a 15 office practice, which is unfortunate, but the registry represents this much more organized, much more secure, much more national quality registry that we were almost trying to create internally at the company. But, now with the registry and being able to capture comorbidities, if you have amputees in the database and all the comorbidities that they might have affiliated with them, we're now able to see what percentages have which comorbidities. There's indications to how those people may do prosthetically. So again, the registry is just at the beginning of being such a powerful tool that once we populate it, I'm guessing that well into the future, we're going to have pieces and combinations of data that foster and inspire even deeper research into these areas. But again, the registry is just, I always call it a gift, right? It's a gift to this patient population to be able to keep track of how they move through their treatment paths.
So we talk a lot about data and collecting data and using evidence for patient outcomes and patient care. So for the patient or the O&P practitioner that's concerned about sharing their data in a registry, and we share our data all over the place nowadays, from a privacy or a security standpoint, what would you say to them?
Yeah, so I would say I'll take security first. I know the security of the registry because I was part of the design and the build. So that can be explained and shared and compared and contrasted to other levels of security. So I think the security one is, well, it's complex. I think it can be easily shared to patients or providers that it is secure, and here are the steps being taken to keep it secure. As far as the privacy side, again, if you take the example of clinical trials to get a drug through the Food and Drug Administration's process and get it to market, there are hundreds, if not thousands, of patients at various stages of those trials taking medications. Privacy is maintained during those trials, and that then leads, those patients' contributions then lead to hopefully a new and effective medication. So in many ways, for me, I think of the registry as, it's important for providers, one, to get behind it, the prosthetist, the orthotist, but then also to educate their patients as to the more patients that are in the database, right, the more information can be aggregated to essentially give them the next level of care or product. I think most patients, if you explain that the data is private and de-identified, and then it's going to be used in the masses to help develop new products or new components, or potentially new treatment pathways. At least my experience has been an overwhelming majority of those patients will say, well, that makes total sense. I'd like to be part of that. It's like someone who's diagnosed with ALS, right? Do you want to be part of the ALS database? And most patients say, of course, I want the profile of me stored somewhere so that it potentially could help someone down the road. We don't want to gloss over privacy and security, but as you said, people are sharing a lot of their data right now without even realizing it. And so, if this is considered sharing your data, it's probably one of the most secure places and one of the most private places, given that healthcare has been one of the earliest and oldest sectors to have privacy laws and requirements and regulations. So from that respect, I feel as though patients and practitioners should really not be concerned about that.
Usually when you find out your data has been leaked, it's not from your health record,
That's right. Yeah, it's typically financial, right?
unfortunately.
And I think there's sensitivities too around payers accessing data, but at the end of the day, I think payers have probably been ahead of all of us in understanding the like community health populations that they're insuring and the metrics around what it costs to insure a group in any given population. So I don't know that insurance companies want to gather registry data in an effort to harm people or keep people from getting the care they need.
I know in any patient community, we always consider a key piece of data as the patient reported outcomes. We have the data that we collect from the clinical systems, the electronic health records, but oftentimes the richest data is what we get back from the patients and how they're doing and what care is working best for them. Can you describe like a really good definition of a patient reported outcome and how is that really important to both the profession and to the patient?
This is a great point, even in explaining the importance of the registry to the providers and the patients. This is a big aspect of the registry, but also just patient care in general. I know we spent a considerable amount of time on developing a kind of a palette of PROMs that the registry went on to endorse. As you said, patient reported outcome measures are simply asking a patient to rate, score, comment, communicate, however the scale indicates they do so, but it's how the patient feels or rates something at that time in that on that day in the office, right? So PROM could be administered anytime. I liken it to back during COVID, Pennsylvania. I'm in the state of Pennsylvania. Our health department had developed an app, and when you got up in the morning, it took like 10 seconds. You could open the app. You'd answer 3 quick questions, highly subjective, right? How do you feel today? Do you have a headache? Do you have, and you could, even the first couple of times I did it, I thought, geez, I could be totally wrong in my own assessment of myself, but they're polling enough people that they still could get the trend lines that they were looking for or thought that were out there. PROMs can be administered anywhere. At Ability, we used to do them either in the patient lobby, like, right, patient comes in, they check in, you hand them a socket comfort score, right? So a socket comfort score could be a patient who wears a prosthetic limb sitting in the waiting area for the 3 to 5 minutes for them to be put in a patient room. They can simply go down either on a clipboard or an iPad or what have you and rate how is the comfort of their socket that day in that 5 minutes they're sitting there. And is this a terrible score or is it a fairly decent score? And even if they're not in the office that particular day for something to do with their leg, maybe they came in to get a new foot cover on the foot or a foot shell, right? Might not be related to the socket, but that in and of itself then is a great time to capture a high rating when they're not having any comfort issues with the socket. Conversely, if they're in for the socket and it's really bothering their limb, they may rate their socket comfort really low. And you say, oh, well, that's a bad score. We don't want that. Well, no, you do, because you over time, and that's the key longitudinally, you want to be able to show high socket comfort scores during visits, and you want to be able to show a few lows, because we all have good days and bad days, and particularly those people wearing these types of devices don't have a super static or status quo kind of with their limbs. They do different activities, wear different shoes, they're in different environments. So things can change in how the device interacts with the body. It's important to capture the good with the bad. But again, it's a piece of the picture. It's a self-reported, and that's very valuable to capture the patient's impression or opinion of how they think they're doing. And these are super important to the profession because it helps to inform us of what people's impressions and expectations, right? How they're interpreting wearing a limb. A lot of people, when they get a limb, they haven't had an amputation before, so they don't really know what to expect. So it helps to establish those expectations. And again, you could so it's a socket comfort score. There's other patient reported outcome measures. There's a balanced confidence score, where again, you might ask someone how they a certain set of questions, how they feel without wearing a brace, and then you put a brace on them and ask them the same set of questions. And you can see oftentimes a difference in how someone rates their own confidence in their own balance, whether they have a brace on or not. And that's a very real delta for that patient. It would be like, hiking a mountain and you're doing okay. And then someone puts a stave or a stick in your hand, and all of a sudden the time that you're hiking picks up and you're faster because you have a stick to push off. So, these are very real differences for patients. So it's important that that subjective nature is a piece of the puzzle. It's certainly not all of it. And then, like any good PROM, it requires interpretation by the practitioner, and then that feedback loop back to the patient to say, this is what this means. This is what your rating kind of means, and how it translates into what I, as a practitioner, might do next for you to try to increase your PROMs.
I think it's key to note that it's important to have that professional interaction and interpretation of those outcome measures back to the patient. So that communication is key.
Yeah.
Patient can't just look at those numbers on their own and figure it out.
Yeah, that's right. And I think that's a good point too, as you tie that together. It's like, and I would say this, in our offices, at least our experience was, once you started introducing your patients to PROMs, patients actually became quite engaged and excited about, well, what's the next PROM I can do?
Hmm.
Because then they realize this is valuable both to the practitioner and the patient, to have this like running longitudinal scoring going on. And it can be insightful that way to maybe, lead to like better predictive comments when you're thinking about sort of looking at their past and how often they needed a new socket. You might be able to predict a little bit better in the future. So yeah, they would get pretty jazzed up about, well, wait a minute, we can't get into the appointment, we have to go through our PROMs. It's like, okay, now I have the patient holding me to account. That's pretty cool. Um,
It is, and it's nice that it's a way to engage the patient
yeah,
in their own care.
that's right.
So what's a time in your life personally when you were glad that someone had data at, a time when some kind of a registry or electronic record or some kind of a database of data impacted you or your family, where that data was important and made a difference?
Yeah, so this is a big one. This is a big one for me, and perhaps maybe why my influences are so strong towards data without even realizing it. But so my wife works in genetics, and probably 20 years ago, it's going on 20 years probably, that I signed up for 23andMe, one of the DNA
Mhm.
sites, and began looking at, whatever the markers and things that 23andMe could identify back then. And so I've been logging into 23andMe for probably at least 15 years. And the type of information they're able to continue to expand on, and aside from them having financial issues now because I need to say that because I think they're like bankrupt or something. But it doesn't change the fact that the data, the information they're able to glean and start reporting back to consumers like myself, in my case, prompted me at some point when they posted a new report in my file. I was able to seek out a genetic test related to some information that they had found, and was actually able to seek out like genetic counseling and understand what a deeper test result would mean for me personally. And that's also happened in a very standardized way with other people in my family. So having a wife that understands the science and can translate it, interpret it, has really helped me kind of translate. Okay, well, I hear this all the time about DNA and genetic testing and family histories and risk factors. And I think like, well, gosh, that's an easy translation over to P&O. Like, why in P&O aren't we? let's let's essentially do the do the genetic testing on your prosthetic limb, and
Mm.
the and I think the registry is, it's the tool to do that. And so maybe not completely analogous, but I like to think of it in terms of, let's ask those same similar questions as it applies to another profession. So yeah, it's really neat. Thanks for asking that.
Yeah, I think so. So let's pull out your crystal ball. So what does
Yeah.
the future of O&P look like in 15 years, given all this
Yeah.
data that we have? And I think, data is a part of our everyday life. It's woven in. We now have AI, machine learning, chat GPT, everything now. So
Yep.
with what does O&P look like, or what could it look like in 15 years? And what role does data sharing and the registry do you think have in getting us to that future?
Yeah, it's a great question and impossible not to think about it. My hope for it is that, the registry becomes, overwhelmingly populated with rich data. And from that, we can keep curating better treatment plans, better treatment practices. And that would kick off more, research as an offshoot of all that quality data sitting there so that we could learn new things about our patients and how they react to the products we use and the care that we give. So and I think along with that, there'd be more customized treatment plans, perhaps. We'd be able to be a lot more predictive than we currently are. I think as healthcare providers, it's fair to be cautious. And when you're providing someone prognosis type information, but it's also, I think, along the lines of like anticipatory guidance and being able to share with patients that we do have 300,000 data points around patients like you. And we see that in the first 10 to 15 days after receiving a limb, this could happen. I mean, that's really powerful knowledge to share with a new caregiver and a new patient that's entering kind of a path they've never been down. So being predictive, I think, and then hand in hand with that goes earlier interventions. And I think in my mind's eye, I see earlier intervention as being like tied to remote monitoring, possibly, where the devices and our care becomes the ability to track a patient outside of the office and track them in a way that's functional performance tracking, not like, I don't care if they went to Target or Walmart or the grocery store. It's more measurements, getting KPIs back on the performance of the device. I think help lay claim to earlier intervention and giving me the ability as a practitioner to get some feedback outside of that subjectiveness of the patient that might say, hey, the socket wall is starting to fatigue. You should get this patient in within the next week to replace the socket. That's earlier intervention. Why wait till the socket cracks to get the patient in? I just got a notice from Easy Pass, right? Your transponder battery is probably nearing being dead. You need to send your old transponder in and we'll send you a new one. And I thought, well, geez, they have some clock on my transponder to tell me it's dying. And I thought that was a nice touch. Like, yeah, why would you catch me after I've been through the toll booth 5 times and I'm being charged the maximum? So again, just trying to look for other opportunities in other industries that can catch us up and even accelerate us as we go forward in that next 15 years. I think that would, remote monitoring and being able to get better at customizing the care and being predictive and providing earlier intervention, I think all makes sense in terms of raising the quality of care and being able to measure the quality as importantly.
Always great thoughts, very forward thinking and insightful. Thank you so much for your time today. Always great talking with you.
You're very welcome. And you as well, Sean. Thanks for asking. Thanks for asking me on.
Thank you for joining us on Data That Moves Us. Whether you're a clinician, researcher, patient advocate, or other expert, your voice and your experience matter. Stay connected with us on social media through LinkedIn and Instagram. Together, we're building the evidence that drives better outcomes. To learn more about the Limb Loss and Preservation Registry and how to join, visit our website at llpr.org and become part of the movement.